everyone. Thank you for joining today's Web Interface support call for Shared Saving Programs ACOs. This presentation will be followed by a Q&A session where attendees will have an opportunity to ask questions via phone and support question box. And CMS subject matter experts will address as many questions as time allows. Also to note, a recording and the slide deck from today's call will be posted on the QPP webinar library within the next 2 weeks. Now I will turn it over to Lisa Marie Gomez at CMS to begin.
Thank you. Welcome everyone, and thank you for joining us today as ACOs prepare for quality reporting. Again, I'm Lisa Marie Gomez from CMS. Joining me on the call today are other CMS experts and contractors who will share helpful information on the CMS Web Interface quality reporting and answer questions following today's presentation. Today's call will only focus on 2023 CMS Web Interface quality reporting. You can contact the Quality Payment Program Service Center with any of your questions regarding cost, promoting interoperability, improvement activities, MIPS, or quality reporting in general. As previously indicated, today's slide deck, recording, and transcripts will be available on the QPP webinar library within the next 2 weeks. Next slide, please. This is a disclaimer slide about this presentation. Information in this presentation is current at the time of its publication, but we encourage you to please be sure that you're using the resource documents and links that are provided throughout the presentation. Next slide, please. So now I'm going to discuss announcements and reminders. Next slide, please. So the CMS Web Interface will close at 8 p.m. Eastern Time on April 1st, 2024. Your submission will be automatically accepted as submission closes. As a reminder, the CMS Web Interface is accessible using the sign-in link on the Quality Payment Program website. Next slide, please. Dates for the upcoming bi-weekly support calls are listed on this slide. More information and registration links can be found in the 2023 CMS Web Interface support flyer, and also within the ACO Spotlight newsletter. Next slide, please. The Performance Year 2023 APM Performance Pathway, CMS Web Interface Measures Specifications and Supporting Documents for ACOs were published on the QPP Resource Library in December of 2022. These documents include the submission release notes and the coding release notes, which outline any changes that were made to specifications from the 2022 performance period to the 2023 performance period. There were substantive changes to all 10 CMS Web Interface measures. Please note that the measure specification for the 2023 PREV 10 Prevention, Care, and Screening Tobacco Use, Screening, and Cessation Intervention measure was updated and reposted on December 26, 2023. The update was to correct a typographical error on page 23 within the performance calculation flow. On this slide, we outlined the updated language and the previous language so you can easily see the difference. The correct language is to indicate performance not met. We encourage ACOs to download the updated measure specification. Next slide, please. The CMS Web Interface API is available all year for testing in the development preview environment. Please review the links listed here for more information. Next slide, please. Now I'm going to discuss the extreme and uncontrolled circumstances exception. Next slide, please. Public health emergency for COVID-19 was in effect starting in January 2020 and expired on May 11, 2023. All Shared Savings Program ACOs were deemed affected by the public health emergency for COVID-19 under the program's Extreme and Uncontrollable Circumstances Policy for Quality for Performance Year 2023. ACOs that report quality data via the APP and meet MIPS data completeness and case minimum requirements will receive the higher of their ACO's MIPS quality performance category score, or the 30th percentile MIPS quality performance category score for purposes of determining shared savings. ACOs that are unable to report quality data via the APP will have their ACOs quality performance score set equal to the 30th percentile MIPS quality performance category score for purposes of determining shared savings. Review the 2023 APM performance pathway scoring guide within the APP toolkit for more detailed information on scoring. Now I'm going to turn the presentation to Deb Kaltenberg, who will cover other CMS approved reason requests and frequently asked measure questions. Deb?
Thank you, Lisa Marie. Next slide, please. And we are going to go ahead and start with the other CMS approved reason requests. Next slide, please. So this next slide or two is going to go over how to submit requests to skip patients. Some patients may be skipped because they don't qualify for the patient sample or for a given measure. Each measure specification displays a list of the specific reasons why a patient may not qualify for the measure. Requesting another CMS approved reason to skip a patient is a way to skip a patient attributed to a measure during denominator confirmation. These requests are reserved for circumstances that are unique, unusual, and not covered by any of the denominator exclusions or denominator exceptions identified in the measure specifications. These requests must be submitted through the CMS Web Interface, and we ask that you provide detailed information about why the patient should be skipped. There are situations where it is not necessary to request another CMS approved reason. They include if there is an applicable denominator exclusion, an applicable denominator exception, the patient is not qualified for the sample, which include the patient is deceased, in hospice, moved out of the country, or didn't have fee-for-service Medicare as their primary payer, and situations where pre-populated demographic information isn't accurate, for example, their birth date or gender, as well as other demographic information. Of note, the following requests will be denied. For Care 2, the fall screening for future fall risk, any request to skip non-ambulatory patients will be denied as the denominator exclusion for non-ambulatory patients was removed. The expectation is that all patients are screened for fall risk. Next slide, please. Once a request has been submitted, additional information may be requested from the submitter via the email from CMS Web Interface Support at gdit.com. The email from CMS-WI support at gdit.com will be sent to the address entered by the submitter in the skip request. Please reply with the information requested as soon as possible. Contact the QPP at cms.hhs.gov for questions and include the skip request number in your inquiry. If multiple requests for additional detail are unanswered, the request will move forward in the review process using the information available. Once a decision has been issued, the request cannot be reopened. If another CMS approved reason request is approved, the patient will be skipped and another patient must be reported in their place for the measure if available. If other CMS approved reason request is denied, the patient will remain incomplete until you complete reporting on the patient. Please note that when submitting your requests for another CMS approved reason during the last days of the submission period, it could cause your request to not be processed. So we recommend submitting your request as soon as possible. More information on how to submit other CMS approved reason requests can be found starting on page 45 of the 2023 CMS Web Interface User Guide. Next slide, please. And now we're going to get into some frequently asked measure questions. They will include questions on Prev 7, Prev 12, and the frailty exclusion. Next slide, please. So we're going to start out with the frailty and advanced illness denominator exclusions, specifically when assessing a patient's age. The measure specifications include exclusions for frailty and advanced illness for the following 2023 CMS Web Interface measures: DM2, or the diabetes hemoglobin A1C poor control, hypertension 2, controlling high blood pressure, PREV5, breast cancer screening, and PREV6, colorectal cancer screening. The measure specification states, to assess the age for exclusions, the patient's age on the date of the encounter should be used. So which encounter should be used to make this determination? The measure specifications don't define which encounter to use when determining a patient's age for the frailty and advanced illness denominator exclusion. For this reason, the patient's age at the end of the measurement period should be used. Again, the patient's age at the end of the measurement period should be used. The sampling process will account for this denominator exclusion through October 31st, 2023. The patient must be at least 66 at the end of the measurement period and meet criteria to be excluded. The patient doesn't have to be 66 when they meet the criteria, and they could be 65. Allowing a patient to continue to be assessed based on the patient's age at the last day of the measurement period aligns with the 2023 sampling process and is consistent with 2022 and prior years. Next slide, please. Next, we're going to get into the PREV7 preventive care and screening influenza immunization questions. To start, the intent of this measure is for patients aged 6 months and older seen for a visit during the measurement period to receive an influenza immunization or to report previous receipt of an influenza immunization. In regards to telehealth, report of previous receipt of an influenza immunization during the flu season may be completed during a telehealth encounter. The influenza immunization itself, however, cannot be completed during a telehealth encounter. Next slide, please. Here we're going to go over some of the scoring guidance. For performance year 2023, the 2023 CMS Web Interface PREV7 measure captures 2 flu seasons during the measurement period. This is a change from performance year 2022. So you will be capturing potentially the flu season 2022 to 2023 and flu season 2023 to 2024. The change was made to align with the 2023 CMS Web Interface PREV7 measure and the MIPS CQM Quality ID Measure 110. However, please note there are differences in the performance calculation between the 2023 CMS Web Interface collection type and the MIPS CQM Quality ID 110 that prevent their full alignment. A CMS Web Interface measure is sampled and scored at the patient level. So performance on a measure is either met, not met, or a denominator exception applies for each patient in the sample. In the case of the 2023 CMS Web Interface PREV7 measure, a patient is counted only once in the denominator and once in the numerator. And this is whether the patient has a qualifying encounter for a single flu season or both flu seasons. The patient sample file contains 2 new indicators that correspond to the 2 separate flu seasons, one for the 2022-2023 flu season and one for the 2023-2024 flu season. The indicators are checked if the beneficiary qualifies for the sample based on that time frame. If the beneficiary qualifies based on both timeframes, then both indicators will be checked. Next slide, please. And just to note, I will be going over this slide, and it is just to highlight the differences between the MIPS CQM Quality ID 110 and the Web Interface PREV7 measure. So 2023 MIPS CQM Quality ID 110 is scored at an encounter level. Performance is either met, not met, or a denominator exception applies for each qualifying encounter. A patient may be counted twice in the denominator and twice in the numerator. A provider must have documentation showing the patient received immunization for the applicable flu season in which the qualifying encounter occurs to meet performance for the encounter. For example, A patient with a qualifying encounter in each flu season to which no denominator exceptions apply, it is included twice in the denominator. Each denominator eligible instance would be assessed for numerator performance based on administration of the flu vaccination. Next slide, please. And I will be handing this slide over to Prince Bonsu to provide the information. Prince?
Thank you, Deb. On December 21st, 2023, CMS delivered a CMS Web Interface patient sample Excel file to each ACO reporting quality for performance year 2023. The file contains the same patient sample that's available through the CMS Web Interface at the start of the CMS Web Interface reporting period on January 2nd, 2024. New for performance year 2023 are two variables used to identify which flu season or seasons that patients had an eligible encounter for the 2023 CMS Web Interface PREV7 measure. PREV7 22-23 flu corresponds to the flu encounter time frame, January 1st, 2023 to March 31st, 2023, that overlaps with the 2022-2023 flu season. PREV7 23-24 flu corresponds to the flu encounter time frame, October 1st, 2023 to October 31st, 2023, that overlaps with the 2023-2024 flu season. All patients, regardless of whether they're ranked for the 2023 CMS Web Interface PREV7 measure as provided within your ACO's patient sample file, have both of the two variables coded as 1 equals patient does have a qualifying encounter, or 0, which equals patient does not have a qualifying encounter. However, for purposes of reporting the 2023 CMS Web Interface PREV7 measure via the CMS Web Interface, ACOs should concentrate on their ranked patients for PREV7. And I'll hand it back to you, Deb.
Thank you, Prince. Next slide, please. Continuing with PREV7, when a patient is sampled into only one flu season, performance will be evaluated based on the administration of the influenza immunization during that specific flu season. When a patient is sampled into both flu seasons, performance will be evaluated based on the administration of the immunization during both flu seasons. So here's a breakdown. Performance met is the outcome if the patient has documentation showing receipt of immunization for the 2022-2023 flu season and the 2023-2024 flu season, or if performance is met for one flu season and the patient had a documented denominator exception for the other flu season. Performance will be a denominator exception, or this is the outcome, if there is a documented denominator exception for both flu seasons. Denominator exceptions must be documented during the measurement period and be specific to the flu season being reported. Performance not met is the outcome when the patient doesn't receive the influenza immunization for one or both flu seasons, or if the patient qualified for a denominator exception for one flu season and didn't receive the immunization for the other flu season. For example, immunization wasn't administered for the 2022-2023 flu season, and a denominator exception was documented for the 2023-2024 flu season. Next slide, please. This particular slide is a visual representation of what we've been trying to communicate. So when a patient is sampled into both flu seasons, performance will be evaluated based on the administration of the immunization during both flu seasons. So the horizontal is the 2022-2023 flu season, with the vertical being the 2023-2024 flu season. These are your numerator outcomes. If you have immunization administered during both flu seasons, it would be a performance met. If you had immunization administered during one flu season and not administered during the other flu season, it would be a performance not met. If there is immunization administered during one flu season and a denominator exception is documented for the other flu season, you would meet performance. However, in all cases where you have immunization not administered during one of the flu seasons, regardless of what is documented during the other, whether it's an immunization administered, immunization not administered, or an exception, you would not meet performance. Again, this is specific if during one of the flu seasons the immunization was not administered. If you have a denominator exception in both flu seasons, then the denominator exception would apply. Next slide, please. And here are some frequently asked questions that have been received in regards to Prev 7. Our state has an immunization registry. Can this be used as an extension of the medical record to qualify for the 2023 CMS Web Interface Prev 7 Preventive Care and Screening Influenza Immunization, or the Prev 7 measure? Any available medical record documentation, including immunization registry data, can be used to confirm the quality action. Is a documented history of an egg allergy sufficient documentation to use the denominator exception for a medical reason? No, a documented history of an egg allergy in the patient's medical record alone doesn't meet the intent of this denominator exception for the 2023 performance period. Documentation of an egg allergy must be during the measurement period and support that the allergy is still active during the appropriate time frame. Denominator exceptions must be documented during the measurement period and be specific to the flu season being reported. Question number 3. What are the documentation timing requirements for the numerator for the 2023 CMS Web Interface Prev 7 measure? The medical record should support that the refusal, exception, or receipt occurred during the appropriate time frame for the flu season being reported. Prev 7 documentation should be during the measurement period and be specific to the flu season being reported. If the medical record documentation supports that the quality action or exception submitted is relevant to the flu season being measured, it is acceptable. Question number 4. How is the flu season indicated in the patient sample files? The patient sample files will contain the same set of variables included in prior years, with the addition of 2 new indicators that correspond to the 2 separate flu seasons. One for the 2022-2023 flu season and one for the 2023-2024 flu season. Next slide, please. And here we're moving into the Prev 7 Preventive Care and Screening for Depression and Follow-Up Plan overview. The intent of this measure is to screen patients aged 12 years and older for depression and, if positive, document a follow-up plan. In regards to telehealth, screening for depression may be completed during the telehealth encounter. Documentation of a recommended follow-up plan for a positive depression screen may be completed during a telehealth encounter. Next slide, please. And here are our frequently asked questions received for the Prev 12 measure. For the 2023 CMS Web Interface Prev 12 Preventive Care and Screening for Depression and Follow-Up Plan, what documentation is needed? This measure requires documentation that a screening was conducted with a standardized depression screening tool. It's recommended that both a score and clinician interpretation of the score is documented, especially when a patient screens positive. At a minimum, the medical record must contain documentation of the tool's name and results of the screening with a score or clinician interpretation of positive or negative for depression. Each standardized screening tool provides guidance on whether a particular score is considered positive for depression. Question number 2, The 2023 CMS Web Interface Prev 12 measure specifications state that the screening results must be reviewed and verified and documented by the eligible professional in the medical record on the day of the encounter. What is the definition of an eligible professional? The intent of this statement is to clarify that the quality action should be completed by an eligible clinician. However, others within the organization may complete the quality action. The quality action can be completed by anyone the organization considers qualified. Question number 3, how is a qualifying encounter defined for the 2023 CMS Web Interface Prev 12 measure? A qualifying encounter is the encounter used to evaluate the numerator, which is the encounter associated with the most recent depression screening. The quality action isn't limited to a specific encounter type to meet the intent of the measure. Question 4, does conducting a PHQ-9 after a positive PHQ-2 count as appropriate follow-up for the 2023 CMS Web Interface Prev 12 measure? No. Per the 2023 CMS Web Interface Prev 12 measure specification, additional screening and assessment during the qualifying encounter doesn't qualify as a follow-up plan. Next slide, please. Question number 5. Why was POS exclusion or place of service 12 column included in the 2023 CMS Web Interface Prev 12 coding document Encounter Codes tab? So effective January 1, 2023, the American Medical Association made significant changes to the CPT coding for evaluation and management services. The codes for E&M in the home setting, 99341 through 99350, were combined with the codes for the E&M services in a domiciliary or rest home, 99324 through 99340. In 2022 and in prior years, Prev 12 didn't include the CPT codes for E&M services in a home setting as denominator-eligible encounter codes. However, the measure did include the CPT codes for E&M services in a domiciliary or rest home. As part of the 2023 CPT updates, the AMA repurposed the rest home CPT codes to represent both the home and rest home settings. To maintain the allowable settings for the 2023 CMS Web Interface Prev 12 measure, an exclusion of POS 12 or home was added to the revised codes. Question 6. Can you explain how to implement the place of service exclusion 12 column included in the 2023 CMS Web Interface Prev 12 coding document Encounter Codes tab? The intent of the addition of column G for these encounter codes is to indicate that these CPT codes will only be included in the measure when they're not associated with a place of service 12. Therefore, these encounter codes with a place of service 12 are excluded from your patient sample. These updates reflect the AMA's revision to CPT E&M coding effective January 1, 2023. Question number 7. Can we meet performance for the 2023 CMS Web Interface Prev 12 measure using depression screenings conducted in a home setting? Yes. While encounters associated with the place of service 12 aren't included in your patient sample, the measure specification doesn't limit the quality action for the numerator to a specific setting. If the most recent documented depression screening was completed during a home-based encounter, it would be acceptable to report the numerator as appropriate. Next slide, please. Question number 8. Previously, a follow-up plan had to be documented on the date of encounter, but the 2023 CMS Web Interface Prev 12, the specification states that it may be documented up to 2 days after the date of the qualifying encounter. Is that correct? Yes, for the 2023 CMS Web Interface Prev 12 measure, a follow-up plan must be documented by the date of the encounter, either telehealth or office visit, or up to 2 calendar days after the date of the qualifying encounter. However, the follow-up plan must still be provided for and discussed with the patient during the qualifying encounter used to evaluate the numerator. Question 9, can documentation of a follow-up plan be used to infer a depression screening was positive if no results were documented? No. The results must be reviewed or verified and documented by the eligible professional in the medical record to meet the screening portion of this measure. Question 10. Should patients with any history of depression or bipolar disorder be excluded from the 2023 CMS Web Interface PREV-12 measure? Yes. The intent of the measure is to screen for new cases of depression in patients who have never had a diagnosis of depression or bipolar disorder prior to the qualifying encounter used to evaluate the numerator. To implement this guidance, the qualifying encounter is the equivalent to the most recent depression screening. A patient should be excluded if they have ever been diagnosed with depression or bipolar disorder prior to the qualifying encounter used to evaluate the numerator. Question 11, does a certain condition, intellectual disability, impairment, Alzheimer's, dementia, autism, qualify a patient for a denominator exception? The 2023 CMS Web Interface PREV-12 measure specification doesn't define denominator exceptions by specific diagnosis. If the patient qualifies for the 2023 CMS Web Interface PREV-12 measure, and there's a medical record documentation that the patient wasn't screened for depression due to a medical reason, for example, cognitive, functional, or motivational limitations that may impact accuracy of results, patients in an urgent or emergent situation where time is of the essence and to delay treatment would jeopardize the patient's health status, then it would be appropriate to select the denominator exception. Next slide, please. And I will hand this slide back to Lisa Marie Gomez.
Thanks, Deb. Now I'm going to discuss resources and where to go for help. Next slide, please. Please note that the 2023 submission resources are available on the Quality Payment Program Resource Library. Direct links to these resources are distributed via the ACO Spotlight newsletter, with the first set of resources included in the December 13th Spotlight newsletter, and the last set of resources will be included in the January 11th ACO Spotlight newsletter, which will be tomorrow. So check your ACO Spotlight for all of the links for the resources that we have discussed and actually listed here today. We encourage ACOs to review these documents if you have questions on quality reporting and measures. Next slide, please. So where to get help from CMS, or how to get help from CMS. If you need additional resources, please refer to the contact information listed on this slide. Now I will turn this portion of the support call to Haley to begin the Q&A session.
Thank you, Lisa Marie. We can go to the next slide, please. We are now going to start the Q&A portion of the webinar. You can ask questions via the Q&A box, excuse me, or through the webinar audio. To ask a question via the webinar audio, please raise your hand and we will unmute your line so you can speak. To submit a question anonymously via the Q&A box, please click Send Anonymously. Otherwise, all attendees will be able to view your question. So to start, I see we have a few hands raised. So Jason, I'm going to unmute your line if you would like to unmute yourself to ask your question.
Yes, can you hear me?
Yes.
Yes, I'm trying to get 100% clarity on something. So if you can go back to the slide that had the depression screening questions, question number 1. Are you able to switch the slides, or do I just need to talk through it?
1 second, please.
Okay, thanks. So the response here is different than we have seen in the last few years, and I want to get 100% clarity on this. So the way I read this, it's saying if a clinician gives a depression screening and records the score, that is good enough to meet the screening portion of the measure, and they do not have to review every single screening, which is indicated that they do in the specs and in question 9. So which is it? Can you please give 100% clarity on what it either is or it isn't required for every single screening?
Hi, this is Katie from the PIMS team. So the intent of adding additional language here was just to provide a bit more clarity, I guess, on the minimum expectations when it comes to documentation of this particular measure. So as you mentioned, it does state at a minimum, the medical record must contain documentation of the tool's name and the results of the screening with a score or clinician interpretation of positive or a negative for depression. The expectation is that the clinician should be reviewing and verifying the results, but for documentation purposes, what is outlined in question 1 and also within the measure specification, you should be meeting those minimum documentation requirements. How specifically that's documented in your medical record is up to your organization, and this is just to try to explain that a bit further. So you're correct in that it does look a bit different than it has previously, but as long as you're meeting those minimum documentation requirements, you should be good.
Thank you, but that didn't answer my question. So I'm still not clear. Is it absolutely required that the clinician review every score, or if the score is present tied to the actual screening, they do not have to review it? This is a very important point because this could change clinician workflow.
So the intent of the measure specs are not to, change your workflow. I guess, for purposes of ensuring each patient is screened and receives appropriate care, the expectation would be that the eligible clinician is conducting screenings and following appropriate processes. However, in terms of documentation for the particular measure, it is up to the organization how specifically that's documented, whether they're documenting the results with a score or the clinician's interpretation of those results.
Okay, so let me ask it another way. If we're audited, would we fail the measure if there's not documentation that the clinician reviewed every single score?
So again, I know this is something that we have stated in the past for past calls, but when it comes to medical record documentation and in terms of a potential audit, the expectation is that your documentation would support the information that you've reported. So if you're able to support that the screening was conducted, the results of that screening, whether it's the score or the clinician interpretation and appropriate follow-up as needed, that would be sufficient for the measure, but we cannot provide specific feedback as to what specific documentation would meet the intent of the measure or suffice in an audit. And I guess if you want to talk through this further, we suggest that you submit a ticket to the service center. That's qpp@cms.hhs.gov, and we can talk through it a bit more.
Thank you, Katie. And then we had a quick question in the chat to please go back to the first announcement slide. So if we could go back to slide 4, please. Thank you. And then we had another question in the chat. Our ACO has seen 3 clinic IDs that are not part of the ACO in this year's 2023 web interface sample. This has never happened in previous WI reporting. Just wondering if others have seen the same.
Hi, this is Sandra Slaughter from the Division of Quality and Price Transparency. So for the patient sample file, the clinic ID variable is populated with the taxpayer identification number or the CMS certification number, CNN, at which the patient received the most primary care services. It is possible that the clinic ID, which the patient received the most primary care services, may be outside of your ACO. However, by virtue of being sampled into the CMS Web Interface, CMS has identified claims for these patients submitted by your organization. In order to be chosen for inclusion in the CMS Web Interface measure sample, these patients must have had at least 2 eligible services with your ACO during the measurement period. CMS expects organizations to make a concerted effort to obtain medical records for their assigned and sampled beneficiaries, and this includes collaborating with physicians and or other clinic staff inside and outside the organization. Including but not limited to the 3 MPIs provided in the CMS Web Interface, as well as facilities both inside and outside the organization, with collaboration attempts being repeated throughout the course of the data collection period as needed. Thank you.
Thank you, Sandra. And then I see we have a question from Mandy in the chat. Mandy, we have unmuted your line if you would like to unmute yourself.
Great, thank you. Yeah, I'm just looking for a little clarification. In previous years, we received kind of that preliminary file of that came out on December 21st, and then usually kind of the first week of January, the full week, we would get the final file. We've not received that for our ACO. Is that not going to come out and we should be using the list we received on the 21st, or is there something else coming?
Just for clarification, is this in reference to the patient sample?
Yes.
Hi, this is Sandra Slaughter again. The patient sample is within the web interface. So the file that was received on the 21st through ACOMS allows ACOs the opportunity to begin their data collection prior to the web interface opening on January 2nd. But the sample, the full sample file is in the web interface, and it should match the one that you received on December 21st.
Okay, thank you. So this is my first time using the actual web interface through QPP. I've always worked with a vendor in the past, so we need to go into QPP under the sign-in and we can get our list, is what I'm understanding. Okay.
Yes.
Thank you.
Thank you. And then we have another question from the chat. For Prev 6 colorectal screening, if a patient meets exclusion but still has the screening, can we submit yes on screening, or do we submit the exclusion for frailty and acute illness exclusion?
Hi, this is Angie. If the denominator exclusion applies to the patient, then the exclusion should always be reported, regardless of whether the quality action was completed for the patient. This ensures that the intended denominator population is captured for the measure. And you can find this information in the 2023 CMS Web Interface frequently asked questions on pages 13 and 14. Thank you.
Thank you. And I see we have a question from Brenda on the line. Brenda, we've unmuted your line if you would like to unmute yourself.
Sure. Just
Brenda, would you like to unmute yourself? Oh,
I didn't mean to hit that button.
okay, thank you. I see we also have a question from Betty on the line. Betty, we've unmuted your line if you would like to unmute yourself.
Yeah, hi, thanks. I had a question about some of we have like 2 or 3 patients in our patient sample letter or sample that we received that does not have the same patient name as we have in our EMR system, so it is different. And just wanted to question that. So if it came through and it does not match ours, how do we submit? Do we just put that we can't find the form, or, you know, how do we get that so that his patients aren't included? What is the process?
Ethan, would you be able to address that question? If they could make changes to the name in the web interface?
Yeah, so I'm sorry, do you mind repeating exactly what your question was?
Yeah, sure. So in our patient sample list, we found about 3 patients that we like run an Epic tool for as well to match all of this up when we do the subtraction piece for it. And it does not match. So it doesn't match our patients that we have in our actual system precisely. So usually what we do is we have to have at least 2 to 3 patient identifiers before we say, yes, that's the patient. That's our process as an organization. And then, so this does not match that. So I can't say for 100% certain that this is the same patient because of, you know, like the middle initial is wrong or the spelling of the last name is incorrect. So just curious of what we do with those patients that's on our list. How do we mark them?
So I would think in that scenario where you are unsure whether or not the patient is the same, it would fall under a skip request.
So I just skip that patient, or do I have to submit a skip request to CMS for that?
Yeah, I believe you would need to submit a skip request to then have approval that basically you're skipping it because you are not 100% confident that it's the same patient.
Okay. All right. Thank you.
And Katie Moore, is there any information that she would need to include for that skip request for it to be reviewed by CMS?
When submitting the request, I would just ask that you make sure that you're as detailed as possible within that. And there are some instances, I do believe, where demographic information can be updated within the web interface, but we can take a closer look at the right course of action for this once the skip request is submitted. So again, just be as detailed as possible. And then if we have further questions or need to walk you through anything, we'll reach out via email. Thank you.
Yeah, and that was initially what I was thinking, was that you could update the demographic information, but I think because the question was specifically that they don't have enough classifiers between them to confidently state that it is the same patient, that's why I was thinking the skip request would be the best path.
Okay, yeah, we can, we'll take a look at it and see what we can do there.
Great. Thank you.
Okay, thank you all. So we have another question from the chat. will Prev 7 say pay for performance, or will it be scored as pay for reporting for the 2023 performance year?
This is Lisa Marie Gomez of CMS. So we've received actually several questions similar to that in the Q&A box. And I just want to note that for Prev 7, and as we noted earlier, all 10 web interface measures have substantive changes. So for the so for Prev 7, it did have substantive changes. Just because there are substantive changes does not necessitate or equate that it would be, let's say, pay for performance. This measure for 2023 was able to have a benchmark, even though there were substantive changes. So because there is a benchmark and we are able to assess performance, the measure will be scored. So it is pay for reporting for 2023.
Thank you, Lisa Marie. And then we had another question from the chat. Where are the indicators checked for Prev 7 in the submission template? Is there a column with a check mark?
Hi, this is Prince Bonsu from RTI. So the two indicators, the Prev 7 2022-2023 flu indicator, and then also the Prev 7 23-24 flu indicators can be found in the patient sample file that was provided through ACOMS to ACOs, and that can be found all the way to the right, so they are the last two columns within that file. Thank you.
Thank you. And then we have a question from Emily on the line. Emily, we've unmuted your line if you would like to unmute yourself. Emily, are you there? Okay, we'll come back to Emily. We also have a question from Kelly on the line. Kelly, we have unmuted your line if you would like to unmute yourself.
Yes, my question's a little different on 1212 than the previous speaker. In the past, we've been very specifically told we could not presume a score was negative unless it was 0 without a provider interpretation. Does this new wording mean that if the tools standard does not require action, that we can use that tool standard without documentation of negative by the provider?
This is Deb. If it is possible, can we get back to that question? And if we're unable to do so during this call, would it be possible for you to open up a ServiceNow case, and we will ensure we get you an answer?
Yeah, it's just with that change in the wording in the past, we have not been able to make that presumption unless it was 0. But this looks like it's giving us the option to use the tool's guidance, even if it's not 0, and that's what we want to clarify.
Right. No, I understand. And I actually have been able to get the information from a colleague. They would need to document a score or interpretation. And if that doesn't quite answer your question, I will make sure to get additional information and we will get it back out to you either today or if you don't get it.
So the score alone is, for instance, if it's a 4 and the tool says that that is none, we can use the tool without the doctor saying negative, because the score lines up with the tool's guidance. So what I'm saying is it does have a score. It does not have an interpretation. We can use the guidance from the tool.
Hi, this is Katie. So within the measure specifications, yes, it does provide that additional guidance. So it does outline the minimum documentation expectations for the measure, and specifically at a minimum, you must have documentation of the tool's name and the results of the screening with the score. or clinician interpretation. So per the measure specifications, as long as you have documentation of the score or the interpretation, it meets the intent of the screening portion of the measure.
Thank you.
Thank you. And then we have a couple of questions in the chat just asking for Prev 7 2023-2024 flu, just to confirm the dates.
Hi, this is Katie. So yes, I would like to go over the dates for Prev 7. So just to provide a little bit of clarity. So this information is also outlined on page 5 of the measure specification if you need something to refer to. So if submitting this measure for a qualifying encounter between January 1st, 2023 and March 31st, 2023, the influenza immunization should be administered to the patients during the months of August, September, October, November, or December 2022, or January, February, March of 2023 for the flu season ending March 31st, 2023. If submitting this measure for a qualifying encounter between October 1st, 2023 and December 31st, 2023, the influenza immunization should be administered to the patient during the months of August, September, October, November, or December of 2023, understanding that the flu season does end March 31st, 2024. If the patient had a qualifying encounter between January 1st, 2023 and March 31st, 2023, and a qualifying encounter between October 1st, 2023 and December 31st, 2023, the patient must have documentation showing receipt of immunization during the 2022, 2023, and 2023-2024 flu seasons. There were some questions related to slide 18 and the mention of the October 31st date. And that is just to outline the time frame in which the sampling occurred. So for that second flu season, sampling occurred from October 1st to October 31st, 2023. But you can still look within the months of November and December for the immunizations for those patients. And again, as Lisa Marie stated, the changes to this measure were outlined in rulemaking and were considered substantive. So although the flu season does end March 31st, 2024, that is in alignment with the CQM and with rulemaking as outlined. Thank you.
Thank you. And then we have a question from Susie on the line. Susie, we've unmuted your line if you would like to unmute yourself.
Wonderful. Can you hear me?
Yes, we can.
Wonderful. This is actually great timing because my question is to follow up with what Katie had just discussed. So we received our QPP file, and those patients for the Prev 7 measure who do not have an encounter for the 2023-2024 sampling period flu season have a response of no encounter, and it says this cannot be changed. However, we verified in several patients' medical record that they did have a qualifying encounter between October 1st of 2023 through December 31st, 2023, and received a flu vaccine. So how are we allowed to change that when it's been pre-populated with no encounter and CMS has not received a claim for that encounter? How are we able to change that result in order to get points for that specific quality measure for our reporting?
Hi, this is Katie from the PIMS team. So this particular question, I know we've had quite a few of these come through. This is something that we'll need to take back and kind of look into a bit more and can provide updates as follow-up. So I know there were a lot of these questions coming through in the chat as well. So for folks who are experiencing the same scenario and have this question, we just ask that you submit those to qpp@cms.hhs.gov, or you can always call the phone number at 1-866-288-8292. And just to sort of help expedite the process, you can always indicate that it is for 2023 CMS Web Interface reporting, and that way it will ensure it gets routed to the appropriate team.
Thank you. And then we have another question in the chat. How can we report the 2023-2024 flu season when it is not over yet? We may have a patient that is not in the numerator, but they still have 3 months to receive the vaccine and would be compliant at that point.
This is Deb from the PIMS team. If you do have a patient sampled and had an eligible encounter during that period of time, the expectation is that they have either received the flu vaccine or there's documentation as to why they may not have. So you would need to go ahead and report based on the information you have at that point in time. Thank you.
Thank you. And then I see we have Jennifer on the line with the question. Jennifer, we've unmuted your line if you would like to unmute yourself. Jennifer, are you there? All right, we'll come back to you. And I see Emily is on the line again. Emily, were you able to unmute yourself now? Okay, Emily, we will come back to you as well. We also have Sarah on the line with a question. Sarah, we've unmuted your line if you'd like to unmute yourself.
Hi, actually, I know I asked them in the chat, but this is different about the flu season since it's not over yet. Does that mean you would accept from the 23-24 flu season a patient saying they're going to get their flu shot later since they've been offered, and instead of just saying they're not going to get it, they said they will get it some other time since the season isn't over yet?
The best response I can give you, Sarah, is you would need to follow the measure specification. And I am pretty sure, and I can pull up that spec, that just documentation that the patient is going to get the flu vaccine is not sufficient to meet the measure.
Then how can you use this measure if the season isn't over yet, if the patient's saying they're going to get it later and we're reporting before the season's over?
Basically, the information I can provide is that this is in alignment with the CQM specification in this case, and what we are asking is that you report the measure based on encounters during the appropriate flu seasons as applicable.
Thank you.
Thank you.
And we have some more questions in the chat. This question reads, please confirm the change to Prev 10 mentioned in the beginning only applies to the PDF specs, not the Excel template or Excel code list.
Hi, this is Angie from PIMS. That's correct. Only the narrative specs were reposted, and the update was actually in the measured flow within those specifications. And that's all that was reposted. Thanks.
Thank you. And then another question from the chat. For Prev 7, our patient reported receipt of the influenza immunization still counted as meeting the measure?
And this is Deb. Yes, that would be acceptable as long as you have medical record documentation that the patient received the flu vaccine for the appropriate flu season. That would be acceptable. And just to go back and to kind of reiterate something from the last call or I believe it was Sarah. If your medical record documentation basically is that the patient has declined the vaccine because they're going to be receiving it later in the flu season, that would meet as a patient reason documentation. So there is the possibility that by your medical record documentation, you would be able to have an appropriate denominator exception based on the fact that the patient is not wanting to receive the vaccine during this period of time. So just an idea of something you would be able to look for. Thank you.
Thanks, Deb. And we have a couple of other questions on Prev 7 from the chat. So one is, if there's no qualifying encounter for one of the flu seasons, but a documented influenza shot the other, does the patient meet the numerator?
And the answer to that is yes. If you don't have an encounter for one of the flu seasons, and so you're only reporting on a single flu season because that's where the patient has been sampled, then a single performance met influenza vaccine received would meet the requirements. Thank you.
Thank you. And one more question on Prev 7 for right now. If a patient is indicated for a particular flu season, do we need to verify from the medical record that the patient had an eligible encounter in the correct time frame?
And the answer to that is no. We don't require that you verify the encounters for which the patient was sampled.
Thank you. And then we have a question. Oh, go ahead.
Haley, sorry. If I can, there's also some questions with regard to Prep 7. So I think I mistakenly said it was pay for reporting. I want to highlight again, it will be scored because it does have a benchmark and we're able to assess performance. So it will be pay for performance. So it will be scored. So just want to note that as we require all web interface measures to report it, even if they have a benchmark or do not have a benchmark, so just make sure you meet all the reporting requirements for all 10 web interface measures.
Thank you, Lisa Marie. And then I see we have Jason on the line. Jason, we've unmuted your line if you would like to unmute yourself. Jason, are you there? Okay. We can come back to you later. We had another question in the chat. Does a BP reading taken at an urgent care center meet the measure requirement for HTN2?
I found the unmute. Can you hear me?
Yes, thank you.
Hi, hello, yes. This is Carol with the PIMS team. And yes, these encounters should be used if the most recent blood pressure value is documented as an urgent care encounter. The coding for this is actually present within the coding document for this measure. Thank you.
Thanks. Another question from the chat. Can we use A1C results from claims data that show a value if we can't find it in the EMR?
Hi, this is Angie from PIMS. No, claims data cannot be used. The expectation when submitting data through the web interface is that the medical record documentation is available that supports the quality action reported. And at a minimum, the documentation must be in the medical record, and it must include a note indicating the date on which the HbA1c test was performed along with the result. Thank you.
Thank you. And then another question from the chat. Will the web interface option be available next year, January to March 2025 for 2024 performance reporting?
Haley, could you repeat the question?
Yeah. So the question reads, Sorry, 1 second. Will the web interface option be available next year, January to March 2025, for the 2024 performance reporting?
So for ACOs, the last year the web interface will be available is for performance year 2024. So as a result, to submit your data for 2024, it would be open in 2025. The system will be open for you to report the data in 2025 for performance year 2024.
Thank you. And also from the chat, does a fall assessment completed during an inpatient stay meet the measurement requirement for care?
Hi, this is Carol again, with the PIMS team. And yes, this measure isn't limited to a particular setting. So an inpatient documentation that is located inpatient would also count. Thank you.
Thank you. We have another question. For the MH1 measure, is a diagnosis of mild major depression sufficient to confirm the patient diagnosis?
Hi, this is Angie from PIMS. You can find the diagnosis codes that are included in the MH1 measure on the denominator codes tab of the 2023 MH1 coding document, and that document's included in the supporting documents along with the measure specifications. Thank you.
Thanks, Angie. And our next question is, so for Prev 7, we should only focus on auditing patients who are marked as no by CMS on the ranking files?
Hi, this is Prince Bonsu from RTI. Again, in the patient sample file, all patients, regardless of whether they're ranked for the Prev 7 measure, as provided within your ACO's patient sample file, will have both of the two variables coded as 1 equal to the patient having a qualifying encounter, or 0 equal to the patient not having a qualifying encounter for Prev 7. However, for the purposes of reporting the measure via the web interface, ACO should concentrate on their ranked patients for Prev 7.
Thank you. And then we had another question. Is Prev 7 pay for reporting or pay for performance since it has a benchmark?
Hi, this is Sandra Slaughter from the Division of Quality and Price Transparency again. Prev 7 is a scored measure. It does have a benchmark. So it will be part of the score.
Thank you. And then we had a question to please go back to slide 20 if possible. Thank you. And then just a reminder that you can call in or use the raise hand function to ask a question or type your question in the Q&A box to be read aloud.
And this is Deb. I believe the question that they were wanting us to go back to this slide 20. First of all, if I got the wrong slide, please send it another question and I will go over the slide that you are referring to. But I'm assuming that we're looking at the scoring guidance for situations where a patient has been sampled into both flu seasons. So I'll go over this slide again and hopefully it clears some things up. And if not, please feel free to open up a help desk ticket. I actually get most of those Prev 7 tickets, and I'm happy to try and address them when it comes to whether a patient meets performance or not when they're sampled into 2 flu seasons. If they're sampled into a single flu season, you're obviously going to meet performance, not meet performance, or have a denominator exception based on that single flu season. But for cases where you have an encounter in both flu seasons, if in both flu seasons you had immunization administered, you would meet performance. In cases where there is an administration of the flu immunization during one flu season and a denominator exception during the other flu season, you would meet performance. In situations where in one or both of the flu seasons you did not receive the immunization, it would be a performance not met. So immunization administered in 2023, 2024, but not in 2022, 2023 is a performance not met. Immunization not administered in both flu seasons is a performance not met. And if you have administration of the flu vaccine not administered during one flu season and a documented denominator exception during the other, that would also be a performance not met. The one instance where it would be a documented denominator exception is if you had an encounter during both flu seasons and there is medical record documentation for both flu seasons of a denominator exception. If anything else needs to be gone over for the 2 flu seasons, please feel free to ask the questions and we'll either get to it during this presentation or open up a ServiceNow case and we'll get to it then. Thank you.
Thank you, Deb. I see we have Angela with a hand raised. Angela, we've unmuted your line if you would like to unmute yourself.
Yes, hi, thank you. Thank you for answering my question about the ranking files for the flu season, but I'm still not clear because this year it looks like CMS pre-filled an answer for every patient that was selected for the measure, and it either says, yes, they had it, no, they didn't, or no, they didn't have an encounter. Since we can't change the answers on anybody that is listed as not having an encounter, and we've always been told that we don't have to validate CMS closed measures if they got through claims, in other words, the ones they marked yes, then we only need to focus on the ones that are marked as no, correct?
So this is Deb, and I will start with this, Angela, and there might be others on the team that need to go ahead and jump in. So as in previous years, if it is pre-filled with a yes that they have received the vaccine, then you are correct. You don't have to do anything additional. That is the one case within the web interface where if something is pre-filled yes, you should be okay with that. For the no's, that is where you are looking to find out if the flu vaccine was administered or if there's documentation of a reason why it wasn't administered. And then in regards to the no encounter, that is what I believe the team has been talking about today, where you can't change that, but I would ask someone else on the team to go ahead and verify that, as that is outside of my area of expertise.
Hi, this is Katie. And yep, just to jump in there. So questions related to no encounter or changing that field, that's where we're asking folks to please submit a ticket to the service center. Just to reiterate that information, the email address is qpp@cms.hhs.gov. And I know there's been folks asking if that information can be shared with the larger group. And yes, we will ensure that any information that comes out of this scenario is communicated to the larger group, so everyone is included on that. So thank you.
Thank you. And then we have a question from the chat. We have 9 patients in our sample that have unknown listed as the clinic ID and blanks for all 3 NPIs. What steps do you recommend we take to locate these patients?
Hi, this is Prince from RTI. I hope that y'all can hear me a bit better now. I saw that there were a few comments that was hard to hear, but to answer the question, the providers in Clinic ID are pre-filled for informational purposes only, and it is expected that there may be beneficiaries without top providers listed. This could be missing for several reasons, such as prospectively assigned or voluntary aligned beneficiaries who have not received primary care services from a specialty used in assignment, but these beneficiaries have at least received 2 primary care visits within the ACO during the measurement period. So the ACO would still be accountable to report on these beneficiaries within the CMS Web Interface. Thank you.
Thank you. And then we have Christy on the line with a question. Christy, we've unmuted your line if you would like to unmute yourself.
Hi, can you hear me?
Yes.
Okay, I have a question regarding hospice referrals. If a patient is referred to hospice at the end of calendar year 23, but didn't initiate services until 2024, do they count as a hospice exclusion based off the referral alone?
Hi, this is Katie from the PIMS team. So the measure specifications do state that if the patient is in hospice during the performance period, that they would be considered not qualified for sample. So being that it was referral rather than they were receiving hospice care at any time during the measurement period, I don't believe that this would qualify them, but we can talk through it further too. If you would like to go ahead and submit a help desk ticket, we can take a closer look at that. That would be qpp@cms.hhs.gov. Thank you.
Thank you.
Thank you. And then as we near the end of the webinar, just wanted to give a couple more options for folks to submit a question or raise a hand for a question. Emily, I know we tried to unmute your line earlier. We're going to try to unmute you again if you're still available. All right, still not hearing anything from Emily. We have Tabitha on the line with the question. Tabitha, we've unmuted your line if you would like to unmute yourself.
Hi, can you hear me okay?
Yes, thank you.
Perfect, thank you. So my question is regarding Prev 7. For the 2023-2024 measurement period, if we are finding documentation of a flu administration that occurs in 2024, are we allowed to report that?
Hi, this is Katie. So the measure specification outlines that for patients that are sampled into the 2023 to 2024 flu season would only be for immunizations that are administered through December of 2023. So it would not include anything administered in 2024.
If I could add to that, if it's a patient report, so let's say we saw the patient in January and the patient reports that they received the vaccine in 2023, maybe October, but the documentation itself is happening in 2024 because they're just now being seen by their primary care. Would that be okay? Like the provider documents?
Sure. So really when reporting via the web interface that it should reflect information that occurred during the performance period. So the intent is not for additional documentation to occur after the end of the performance period. So it should be within the medical record and documented by December 31st, 2023, or attempts to collect information after that should not be included.
Okay, thanks everyone. So that concludes the Q&A portion of the webinar. We're going to turn it back over to Lisa Marie Gomez from CMS to conclude the call.
Thanks, Haley. So I want to thank you all for joining us today for today's support call. As a reminder, the slide deck, recording, and transcript from today's support call will be posted to the QPP webinar library within the next 2 weeks. The next CMS Web Interface support call will occur on January 24th, 2024, and will cover frequently asked measure questions related to Prev 10 and HTN2. Thank you very much, and I hope you have a wonderful day. Thank you.